The Solidarity Fund is a public benefit organisation established about 18 months ago in response to the effects of the COVID-19 pandemic in South Africa. It says it's raised 3.4 billion rand from March last year to September this year. Today, the fund presented its first integrated annual report since its inception. Tandi Nzimande is the CEO at the Solidarity Fund and she joins us. Thanks very much, Tandi, for joining us. So how much of the 3.4 billion rand has been distributed?
So that's still just over 2 billion has been distributed. However, the full amount has been allocated.
Understood.
Yeah.
Just in terms of deciding what ideas you're going to fund, how do you make that determination?
So we're very much driven by the mandate under which we were formed, which was really responding to the COVID pandemic. So in terms of deciding what we will fund, we look at, will it make a significant impact? Is it something that the Solidarity Fund brings additional effort, a sort of additional impact that may not have been available had the Solidarity Fund not been a part of the effort? And is it related very much to COVID? So that remains our focal point. We're still responding very much to the COVID pandemic and its impact.
Just in terms of the intensity of your work over the period, because of course we've had waves at different times of different intensity, is it pretty much consistent that, you know, the work that you're doing, or do you get that much busier, like in the third wave, which was very intense and very sad, of course, as we lost so many lives?
So we do get busier at the time of the waves, but what we are trying to do, or what we've sought to do, is really to try and support the system, the health system, to cope better with every successive wave. And the way that we've primarily done that is through the essential equipment efforts that we've done, as well as the distribution of ventilators, the locally made non-invasive ventilators. And more recently, we've also been supporting in Gauteng and in the Eastern Cape capacity in terms of the nursing capacity. So each wave does come with additional effort from our side, but very much we're trying to build up the capacity so that we're able to hold through each of the waves.
Just in terms of the beneficiaries who get support, do you do a sort of monitoring and evaluation process such that you ensure that the funds have been properly used?
The way that we do that is that because in almost every single instance we work through partners, as a fund we don't have permanent capacity. So we work through partners, we make sure that we engaging with our partners most of the time weekly, at the very least monthly if it's a very long project. We receive reporting on that, and we've got specific requirements as to what we would like to see in our reports, so that we're able to monitor that our funds are being applied in the way that we would like them to be applied, and that they're having the impact that we would like them to have.
Is it a pretty foolproof system? I mean, are you fairly satisfied that there hasn't been any jiggery-pokery with some of the funds that you've used? You know, what sort of governance rules do you have in place to ensure that the money is used to maximum impact?
So our governance processes are very, very robust. And I think a great testimony really to the people who were here right at the beginning, working under incredible pressure under the leadership of Nomkhita Nqweni, where the systems that were set up were rigorous and robust, that you have different people looking at different aspects and bringing in diverse views as well into the process, so that you properly test it. I mean, management will spot opportunities where we believe that it is a good program to perhaps support, and we will take it through the processes. And sometimes we do come out disappointed because our processes are that robust that the various levels, the disbursements committee, an exec level, the disburse committee on a board level, the board itself will come back and will say that project we will not be able to put in sufficient internal controls.
Yeah.
To be able to control, to make sure that we are spending as we would like.
Tandi, one last one. The Solidarity Fund was set up to deal with the impacts of COVID-19 and to alleviate some of the problems. We're doing not so bad in terms of our vaccination. There are enough vaccinations in the country to vax everyone that wants to be. We have some vaccine hesitancy and all of that. But as we reach the end of the road, do you think the Solidarity Fund's work is going to be done quite soon, given that I suppose you've done most of the work?
We trust and hope that it will be so. We still have a fair amount of work in terms of the people that we need to get a lot of South Africans across the line in terms of the information that is available for people who have some level of hesitancy. There's been a huge wave. There have been waves of misinformation that have been coming through, which just really we need to correct. And so there's a fair amount of work in that respect. And whilst the vaccines are available, we still only about 16% have, if I've got that right, on the vaccination rate. So we've still got a fair amount of runway ahead. But once we clear of that, then our work will be done, and we will be grateful for that.
Super. Tandi, thank you very much for your time, ma'am. That was Tandi Nzimande. She's the CEO at the Solidarity Fund. We're going to go for a quick break.